Assalamualaikum warahmatullahi wabarakatuh. Very good morning to everyone. Okay, today we have two important topics. Okay, is on ENT and Ophthalmic Emergency. Okay, so I think I invite Amiza to proceed with your presentation. So while you are presenting, sometimes I will stop you for a while and will explain further. Okay.
Okay, Doctor.
Yeah. If anyone got any questions, you can raise throughout the presentation or at the end of the presentation. Okay, Amiza.
Alright.
Boleh proceed.
Okay. Okay, Bismillahirrahmanirrahim. Assalamualaikum and good morning everyone. So I'll be presenting about ENT emergency lah, supervised by Dr. Rafeek. So we will start. ENT emergency is not very, kiranya taklah selalu tak perasan pun it is a ENT emergency. So for ENT emergency, we have to approach patient by using the primary survey. For example, there is A, B, C, D, E that we know. So this for ENT emergency, it's important to know the A, B, and C lah. So we have to, during the primary survey, we have to adheres the patient, kita kena tengok lah patient punya condition, kita kena assess patient punya airway, tengok sama ada obstruction ataupun any compromise lah. If there's any inhaled foreign bodies, we can also exclude any epiglottitis, quinsy, anaphylaxis or also angioedema, croup, any facial fracture lah. Breathing, kita boleh tengok sama ada patient macam nampak susah nak bernafas dan sebagainya. The SOB lah. Daripada C, circulatory compromise, kita boleh tengok dia punya patient punya hemorrhage. Kalau ada any hemorrhage, for example epistaxis from the facial fracture or any secondary hemorrhage after ENT surgery. So we have to ask the patient about that. So during primary survey, we have to assess the vital signs of the patient lah. So we look for any patient ada airway obstruction, ada SOB atau tachypnea, and then assess the respiratory rate. Either it is less than 10 or 30, it is a warning lah. And also we have to look for the oxygen saturation SpO2 if less than 94, so it's also a warning. We also have to look for the pulse, systolic blood pressure, and also GCS of the patient. So if less than or more than any of these, it's a warning sign for the patient. So we have to assess the patient quickly. So there's a few common ENT emergency. For example, is foreign bodies, epistaxis, acute mastoiditis, auricular hematoma, tympanic membrane perforation, and also peritonsilla abscess. So these are a few that I will cover today. So first we go to the ear. Foreign bodies in the ear, things that are commonly found in our patient will be cotton bud, insects. Otherwise, the symptoms will be patient will come with pain, decreased hearing, nauseous and vomiting, bleeding, and also buzzing in the ears lah, especially if there is insect in the ears. So there is complication for foreign bodies in the ears. They might be lead to perforated eardrum, and also infection of the ear canal lah. So for the treatment, for the insect we can infuse the mineral oil. Tak pasti dekat ED kita ada ke tak benda ni. Also we have to trial of urgent removal of the insect or any foreign bodies lah, to reduce the pain and discomfort. As for organic materials, as for example makanan ke apa ke, kita kena buang secepat mungkin sebab it is more tend to for the infection. There are a few tools that we may use to extract the foreign body. For example, we have crocodile forceps that should be used to remove a smooth and round forceps object lah. Others is we have blunt hook, useful for round smooth object but not if it is impacted. We also have syringe. Ours might not same as the picture lah, but it is ideal for most foreign bodies except if vegetables material. Also preferably use vacuum suction is useful for the majority of the foreign bodies. Okay.
Okay,
Next.
we go back to the previous slide.
Okay, then.
Okay, I think foreign body in a year is not uncommon. Usually, if most of the time we see is patients who have cotton bud in the ear, or they have any insect. Okay, these are the actually common things. So let's say if you see a foreign body in the ear, first is to see if you see an actually insect. First, you have to determine whether the insect is dead or
Alive.
alive. Yes. Okay. If the insect is still alive, then you have to kill it first. So how? So that's why you put the oil. So what kind of actually oil you actually need to use? Here, what we can use the baby oil which you put on the actually baby, or the olive oil. This is some of the options which you can use. Okay.
Okay.
So once the insect tu dah macam mati lah, okay, then after that you can try to remove. Okay. So how do we remove? In ED mainly we can use either crocodile forceps or we use a syringe. The syringe will you attach to a brenula. So you actually remove the needle. Okay. So it's actually very soft. So if you want to use the crocodile forceps, you have to make sure it's under direct visualization. You cannot simply blindly put the crocodile forceps, because this can lead to injury. Injury, you can actually perforate the eardrum. Okay.
So even inserted it in more.
So if you want to use a syringe, what you do, you actually flush. You flush out the foreign body. Okay. Then it's best to use warm saline. Try to find warm saline. Because let's say if you take cold saline, or you take whatever normal saline which have in actually ED, the actual temperature is actually cold. So when you give cold water into the eardrum, okay, after that patient, you will stimulate vomiting. Okay, patient akan rasa pening, develop vertigo, nanti dia akan muntah. Okay. So always use warm saline. Kalau you nak irrigate the ear kat dalam, kita guna warm saline. Okay. So let's say after you try to irrigate, still cannot remove the foreign body, that's when we refer to ENT. ENT. So in there, they have the vacuum. They can use the vacuum suction, or they can use they will still try to actually irrigate, but they will use more pressure lah. Okay.
Okay.
So these are the common things. The other thing which you have to you can see, I think for trauma case. Okay, trauma case, you have to rule out a rupture of your tympanic membrane. Okay.
Okay, betul.
Fine, you can proceed.
Sorry saya menyampuk sikit lah. Boleh dengar tak?
Boleh dengar.
Saya boleh menyampuk sikit. Just kenapa dalam teks Dr. Rafeek cakap kena guna oil? Why can't you just use water? Lemaskan binatang. Why oil? Why mineral oil? Bukan synthetic oil,
Synthetic oil could be dangerous, doktor.
Okay. But why oil? Why not just water?
Mungkin sebab ada few insect yang boleh hidup dalam air lagi, survive lagi.
So you have to understand how insect breathe lah. Insects tak ada lungs, so some of them can breathe through their skin. So and some of them memang actually dependent on moisture untuk breathe. So sometimes just plain water tak mati lah. So that's why oil, because oil will clog up all the pores semua. And bila cakap mineral oil, jangan terfikir benda pelik-pelik sangat. It's very common oil. Kadang-kadang olive oil, things yang commonly jumpa macam Dr. Rafeek cakap, baby oil, oil yang the aim for you is to kill the the insect je.
Okay.
Some people, ada orang kat ED susah nak cari oil. Some people use sodium bicarb and other agent yang memang known not to be corrosive or toxic, tapi boleh membunuh binatang tu lah. Itu je. So jangan macam tak ada oil, panic pula. Tak ada. The aim is to recognize whether the insect is alive or dead. If it's still alive, bunuh dulu. because the movement of the insect dia akan menyebabkan pain. Once dah mati, it's easier for you to remove the insect.
Okay, thank you Dr. So saya teruskan
Continue, boleh.
Okay, next is acute mastoiditis lah. It is a complication of acute otitis media. So patient will be presented with pain, fever, redness, swelling or tenderness over the mastoid process. So mastoid process ni dekat belakang kita punya telinga lah. So patient akan main dengan bengkok telinga lah. Lepas tu kita untuk for the management, kita boleh bagi IV ceftriaxone lah, and also to refer ENT stat for this case because it may leads to infection to our brain. Dia sangat dekat dengan kita punya brain lah. So others is there is surgical therapy to confine to the ears, includes meningotomy, tympanocentesis, tympanostomy, tube placement and mastodectomy lah. Ini selalunya kita tak buat tapi bahagian ENT yang akan buat lah. Untuk meningotomy tu is a procedure to create a hole in the eardrum to allow fluid that is trapped in the middle of the ear to drain out lah. Kita untuk drain out dia punya fluid tu, sama ada pus ataupun just a serious fluid lah. While the mastodectomy is a surgery to remove a cell in a hollow air-filled space in the skull behind the ear within the mastoid bone. So these cells are called the mastoid cell. So we remove the mastoid cell. Okay. Lagi. Okay. So Dr. nak tambah apa yang tadi tu?
Tadi just now, okay, for acute mastoiditis is this is uncommon lah. Most of the time yang banyak kita jumpa adalah your suppurative otitis media kan. Your chronic otitis media, that is more common lah. Okay. Tapi still you have to recognize lah kalau ada mastoiditis lah. Okay. Then treatment for our side memang we can start on the antibiotics. Then there is also a risk of meningitis lah. Actually, if you have any sort of infection yang chronic either at the yang involving the nasal passage, involving the ears, all of this can cause ascending infection. Okay, semua boleh lead to meningitis lah. This yang kira complication paling teruk lah. Okay, can you continue?
Okay. Others, there will be auricular hematoma. It is a complication to the trauma, from the trauma to the ear. So if it's left untreated, it will cause the cauliflower ear lah, macam dalam gambar tu. So telinga akan kembang lah. So the symptom of sama lah, dia akan jadi tender, swelling, akan redness. The patient will come with pain also. So for the treatment, we have to refer ENT, and also for drainage of the hematoma lah, either needle aspiration or IND, and also prevention of the reaccumulation, so we can give the antibiotics for the patient.
Okay, saya jelas sikit kan. Does people actually die of auricular hematoma?
Tak kot.
No.
Tak ada kot.
Does people actually die of auricular hematoma? Kenapa dia masuk dalam ENT Emergency? Kenapa dia masuk dalam ENT Emergency? Saya tak kata dia salah masuk dalam ENT Emergency. People don't die of auricular hematoma. Tapi kenapa dia masuk dalam ENT Emergency? I mean, if you just Google ENT Emergency dalam Google lah basically. So, you find auricular hematoma. So, but why consider as ENT Emergency?
Sebab dia because from the trauma.
Yalah, any trauma pun. So, the issue is, katalah awak ni model telinga. Sumber pendapatan hidup awak ni bergantung pada telinga awak yang cantik digunakan sebagai modeling. Dan tiba-tiba awak ada trauma to the ears, kena tumpuk ke, kena tampar ke, kena tendang, then you got hematoma. Then it's not treated properly, the hematoma is not drained properly. Then awak develop cauliflower ears. Then tak bolehlah jadi model telinga, then you lose your sumber pendapatan. And Malaysia mungkin lah orang tak kisah sangat, tapi if you in negara macam United States apa semua, they can sue you for lifetime loss of income tau.
Okay.
Yeah, so it's cosmetic.
Oh.
So it's cosmetic and it can cause, having contoh model telinga tu saja lah, tapi but people can sue you for lifetime disability ke lifetime loss of income, sebagai contoh lah. So that's why it's considered ENT emergency, bukan in terms of life saving, in terms of it needs to be properly managed, it needs to be trained, so that dia tak jadi cauliflower ears. Because for some people, tak benda ni nampak kan, kita kat Malaysia ni korang semua pakai tudung, so mungkin lah kalau tak lah telinga cacat pun tak apalah, laki pakai tudung kan. Tapi for those yang macam dekat western countries or yang tak pakai tudung, perempuan dapat cauliflower ears ni, it can be debilitating lah, lose self-esteem dan sebagainya. That's why it's considered macam ENT emergency, lebih kepada mental health dan sebagainya. The other issue is, siapa yang selalu dapat cauliflower ears ni? Orang yang, kalau you tengok orang ada cauliflower ears, kadang-kadang you boleh suspect dia ni certain spots or certain pekerjaan lah. Ada? Nanti saya saya Kak Ayu lagi. Kak Ayu ada bagi tak? Ya?
Yang pakai helmet punya sport kot doktor, kiranya macam boxing ke?
Boxing rarely lah, usually wrestlers or wrestling lah, bukan wrestling WWF ni, macam Olympic wrestling or those yang macam
UFC.
Satu lagi sama
UFC martial
yang kadang
martial arts,
most of them they've got cauliflower ears lah, sebab that sport sometimes involve strangling the head, tarik head. Ni just good to know lah, nice to know.
Okay, thank you.
Okay, why the cauliflower ear happen? Because when you have the hematoma there, you will compromise the blood supply to the cartilage. Sebab you punya ear tu, yang kat the pinna, all is cartilage. So when there's a hematoma, you don't drain, so this will compress the blood supply to the cartilage. So nanti dia akan ischemia lah. Ischemia, nanti your ear will become deformed lah. Or your cartilage will be actually deformed.
Okay.
So this one is more to cosmetic lah, basically. You can try to aspirate lah, tapi aspirate kalau patient datang awal, sometimes boleh berjaya. Kalau dia datang lambat, most of the time ENT have to make the incision lah.
Okay.
They incise and then drain. After that nanti diorang akan stitch balik lah.
Tapi dekat ED pun kita boleh buat, doktor?
ED kita hanya boleh aspirate. You can attempt aspiration lah, tapi the incision usually kita akan refer to ENT to do lah.
Okay.
So saya akan skip lah Zan.
Okay.
Next.
So proceed next dengan traumatic tympanic membrane perforation lah. So this one it may be secondary to the acute ascites media ataupun trauma macam tadi tu. And then examination of the ear will show loss of the cone of light as the light usually refract off the tympanic membrane. So bila kita tengok guna otoscope tu memang tak nampak ataupun tak nampak direct to the tympanic membrane lah. And then symptoms, the patient will come with pain, bleeding, hearing loss, tinnitus or vertigo. Mostly diagnosed using during otoscopy. It can be partial or total perforation. And treatment is often unnecessary except for the antibiotic lah untuk prophylaxis for infections. And also perforation with vertigo, facial nerve involvement will always need an immediate referral to the ENT. And also surgery intervention is needed if perforation persists more than 2 months or injuries affecting the inner ear. Okay.
Okay lah, this one is more common in patient yang trauma lah. Kalau patient yang ada direct blow, patient is being punched or slapped kalau kena tampar kat bahagian telinga tu, then this is things which you need to rule out. So if you see patients yang OSCC case, domestic violence, dia ada complain dia kena tampar ke apa, at the ear, at the face, this is yang you need to examine lah. Make sure tak ada perforation of your TM. Okay. So if the perforation is very small, usually dia akan self-resolve. Your tympanic membrane can heal by itself lah. It will take days to weeks. Tapi if the perforation is very big, then memang you need to actually refer lah. Maybe need to buat op lah, surgery to repair. So patient macam ni, your advice would be not to submerge the ear in the water lah. Kalau dia mandi jangan kasih air masuk telinga dia lah. Okay. You don't need to start on any antibiotics unless if already ada signs of infection lah. Kalau just simple perforation because of trauma, usually we will start on antibiotics.
Okay.
Okay, can continue. Boleh sambung.
Okay. Okay. So next kita masuk tentang nose. So nose pun memang ada common dengan foreign bodies lah. So for example kita boleh tengok dengan dalam hidung budak-budak, dia orang suka masukkan batu lah, makanan ke apa dan sebagainya kan. So it may be inhale and cause airway obstruction lah. So the best way to remove is to encourage the patient to blow it out by themselves. Tapi kalau macam budak-budak dia akan susah. So better done by the parents by blowing into the child's mouth while occluding the unaffected nostril. Ini tutup hidung yang tak tersumbat tu. And then blow lah dalam baby punya mouth, so dia akan keluar balik ke hidung yang lagi satu tu. Ataupun boleh guna back bath mask tu untuk produce the pressure. So when the swift path of the air will forces the foreign body down the nostril lah. Okay. Next is epistaxis. Epistaxis may be caused by trauma ataupun idiopathic lah. Trauma usually include with the nasal fracture ataupun major facial injury. So hemorrhage can be severe when associated with hypertension and also coagulation disorder lah. So there's a common site of bleeding which is the Kisselbach plexus. It is an anterior part of the cartilaginous portion of the nasal septum. There's extensive submucous anastomosis from the external and the internal carotid system. So this area is very highly vascularized, exposed to the exterior, and it easily dried and also can be due to the nose picking pun boleh juga bleeding. And bleeding is clearly seen, accessible, and also flows through the anterior nasal cavity. Hence, it is known as the anterior epistaxis. So, Kisselbach macam tengok dalam gambar tu lah yang bulat kecil tu. So memang dekat depan hidung saja. The other common site is Woodruff plexus. It is responsible for posterior bleed and is located at the end of inferior turbinates. But it is very not easy to access lah. So common in patient with extremely high BP, and also blood is usually mostly swallowed. So kita tak boleh nak estimate berapa dah dia punya bleeding. Okay. This is just the blood supply from the blood supply yang ada dekat Kisselbach area dengan also Woodruff plexus tu lah. Okay, next. So for the management, we can start with nasal packing lah. This for kalau anterior epistaxis, kita boleh guna Vaseline gauze ataupun absorbable gel foam oxidized cellulose ataupun kita selalu guna dalam OT lah, Surgicel. Also nasal tampon. For posterior nasal packing, if bleeding fails to stop in 15 minutes, so there's indication for to do the nasal packing. We may use topical anesthetic and decongestant, also double balloon device and polycatheter. Okay.
Okay, you stick to the slide. Okay, epistaxis is not uncommon lah. Usually is you can get it lah because most of the time it's caused because of macam local injury, kan? Macam patient pick the nose, or macam patient very dry condition, dia sesama rub the nose, then can lead to bleeding lah. Anterior bleeding is more common than posterior lah. Okay, most of the time it's anterior. So kalau patient bleeding epistaxis, do all patient we need to do the packing? Semua patient kita kena buat packing. No kan?
Tak payah.
Yeah. So kalau if the patient come to you, you see patient in green zone with epistaxis, what's the first thing you want to tell the patient to do? Nak suruh dia buat apa?
Ice packing.
Ice packing. Okay, you can try to put ice pack. You can put ice pack, then after that, how you want to position the patient? You nak suruh dia dongak ke atas ke bawah ke, macam mana? How?
Dongak ke atas.
Okay, this is a misconception kan. You kena suruh dia ke bawah. Why? You give the patient the yellow bag, ask the patient to look down. So whatever darah kan, semua akan drip down. Kita nak darah semua kena turun. Sebab kalau patient dongak,
dia masuk dalam.
Nanti dia telan. Dia telan the blood. Because blood, one thing is actually toxic. Is irritant. So once it goes into the stomach, memang patient one dia sakit perut, nanti dia akan induce vomiting. So patient nausea, vomit. Nanti bila muntah, nanti you say it's upper GI bleed. Tapi bukan because it's epistaxis. So ask the patient to lean forward. Sambil dia lean forward, you can give the patient some ice pack. So ice you put. So ice, where you want to put the ice? Is it at your nose? Or higher up?
Higher up.
Higher up. Okay, you put higher up. Because the idea is to cause vasoconstriction. So the blood vessel dia constrict, so bleeding kurang. Okay, that's one option. So you can do that. Kalau bleeding tu banyak sangat, or after you do this procedure, you letak some ice still to bleeding lagi, then you can consider to pack the nose lah. Okay, tapi before you pack the nose, you can ask the patient to directly compress. Suruh dia picit hidung dia. Okay, suruh dia picit hidung dia. Okay, tekan hidung macam tu. Okay, so how long you want to ask the patient to compress the nose?
5 to 10 minutes betul?
5-10 minutes. Okay, can you yourself dipegang hidung for 10 minutes? Boleh tak?
Payah jugalah.
Payah juga kan? You akan rasa restless, susah kan nak kena bernafas. You have to breathe through the mouth. Okay. So what we do here, we can kita letak macam penyepit tau. You can take your
pakai baju
kan macam ni. You buat macam penyepit. Okay. So you sepitkan kat dia punya hidung. Like that. Okay.
Okay.
So this one, when you do that, patient is hands free. So tangan dia free, dia boleh tukar baju dia. Okay. Then after that, dia boleh kalau baju dia kotor, then he can hold the bag, can spit out all the blood. So his hands are free. Okay. So you can do this for maybe 10 minutes, 15 minutes. Then you see. Kalau still bleeding again, tak stop. Then your next step, you try to pack the nose dengan tranexamic acid. Okay. You can take some ribbon gauze. Okay, ribbon gauze, the length is very long. Dia up to 1 meter. You don't need to put the whole 1 meter lah. Okay. So you cut a bit, make it shorter. Then you soak it with pure tranexamic acid. Then you pack in the nose. After you pack the nose, you compress balik dengan yang ni. Then you tunggu sekejap. Okay, most of the time the bleeding will stop lah. Okay, besides this, you also can give your IV tranexamic acid. So you bagi IV, you bagi local inside the ribbon gauze. Then you wait for a while. If all of this fail, then only you proceed with your packing lah dengan your tampon. ataupun in your picture, what you show here is your rapid rhino. You have this yeah. Okay, rapid rhino kan. So this one, if you see your photo yang you tunjuk, dia ada some cuff kat situ.
Betul.
So you put in the nose, then after that you kena inflate kan lah. So dia akan ada tamponade effect, it will stop the bleeding. So it comes in various size. Kalau for anterior penyelesaian packing sahaja, dia punya size dia kecil, dalam 5 hingga 7 cm. Dia size dia up to 12 to 15 cm lah. Okay. Then after that, if let's say if it's a posterior punya bleed, you still can use the rapid rhino ataupun you can insert a Foley's catheter yang kecil punya, macam your second photo yang kat bawah. Your second photo lah, can use that. Okay. Tapi most of the time, kalau for Foley's catheter, usually kita akan insert in patient yang dah memang either patient tu is semi-conscious, UCS not full, or patient tak sedar, because it's really uncomfortable lah. Dia memang tak selesa. Kalau patient tu still conscious, we try to avoid lah. Okay, so after you done all the packing semua, then you can refer to ENT lah. ENT. Usually they will keep this packing off for about 1 day lah. Then they will assess the patient the next day to see whether bleeding tu dah stop or not.
Okay.
But this one, if you don't manage well, if let's say patient is semi-conscious, GCS maybe is more than 8 tapi less than 15. If you don't stop the epistaxis, what will happen? Patient boleh ada aspiration. So I've seen before a case, patient aspirated sebab kita tak control the bleeding. So end up kena intubate, then ada aspiration pneumonia, so banyak complication lah. Okay. Okay, can continue lah this one.
Okay, betul. So next will be throat. Throat also there's common for foreign bodies lah. So usually kita tertelan sama ada kacang ataupun battery, fish bones or our dentures itself. Sign and symptom, patient will come with coughing, a prickly or tingly sensation in the throat, pain when swallowing.
Out of the thing that you mentioned, order of dangerousness lah.
Macam tu?
Yang mana? The thing that you mentioned kan, kacang, battery, fishbone, dentures tu. Which one is need to remove urgently?
Battery.
Provided dia tak ada cause airway obstruction lah.
Battery you betul.
Okay. What sort of battery are we talking about?
Battery.
Is it a AAA ke, AA ke, size B ke?
Yang bulat tu.
What is it called? Apa nama dia? Button battery.
Oh, button battery. Okay.
Ini yang biasanya budak-budak ambil, masukkan dalam mulut lah, because it's very small kan. And it's usually in toys. Kalau pasal toys dah RM2 kan, dia pakai button battery yang kecil-kecil, yang very small. And this button battery has always been a choking or swallowing hazard. So certain countries, macam yang I tahulah, macam Australia, memang ban terus button batteries.
No.
Sebab it's just swallowing hazard, and dia swallow, dia akan cause problem lah. I'm sure you gonna get into it later lah. Tapi it's so dangerous that certain countries memang ban terus button batteries. Kita kat Malaysia tak ban lah. That's why you got this kedai RM2 punya toys with button batteries. Just out of interest lah. I think I'm sure you can explain different why battery have to remove urgently, even though it doesn't cause obstruction. Okay.
Okay, so patient akan datang dengan coughing semua tu, pain when swallowing, difficulty in swallowing, feeling of fullness at the base of the neck, sharp pain, really during the kalau kena fish bones lah, ataupun patient boleh muntah darah juga ataupun spitting of the blood sikit. So for the management emergency intervention, kita boleh guna Hemorrhage Maneuver lah. Hemorrhage Maneuver tu yang kita selalu belajar time basic
BLS.
BLS tu. So kita akan stand behind the victim, wrap your arms around his or her waist, and then clasp your hand together in a double fist and place the fist with our thumb side in, just below the victim's rib cage and also above the navel lah. So press into the victim's abdomen and not the rib cage with a quick and upward thrust, and repeat the thrust until the object is dislodged lah. So kalau seorang-seorang pun boleh jugalah, kalau macam if there's no one around you and you are choking, so you can use any object around yourself, or firm object lah, such as back of the chair. So that one hemorrhage maneuver is to use for patient if the patient is full GCS lah. But kalau patient tu dah tak sedap, stop responding, so we have to open the mouth if we can see the thing that caused the obstruction, so we can take it out by ourselves. Kalau tak nampak, so we tilt the person's head back and pinch the person's nose. Place your mouth over the person's mouth and give it 2 breath. And bila tak sedap, kita akan proceed with CPR lah. Push hard repeatedly in the chest center for 20 seconds and check breathing. Okay. So for this one, kita for assess of the patient, kita selalunya dengar sama ada normal ataupun wheezes, ataupun localized absence of the breath sound during auscultation. So we can also do X-ray, chest and also lateral cervical lah. We can either see normal ataupun kita tak nampak pun dia punya foreign bodies tu, ataupun any radio opaque foreign bodies lah. Macam dalam gambar kat bawah tu memang clearly nampak ini ada foreign bodies. So kalau fish bones, it usually stuck in the pharynx or esophagus, and this might be directly visualized using torch, tongue depressor ataupun Tylis forceps. Tylis forceps tu susah sikit nak jumpa KED. Kau ada doktor KED?
No, don't have, tak ada.
Tak ada. So kalau tak boleh nak nampak foreign body tu, to do a soft tissue lateral neck X-ray lah, to look at any pre-vertebral soft tissue swelling ataupun the fish bone, and refer ENT for endoscopy. And as for sharp foreign body, should be removed as soon as possible to avoid perforation.
Yang paling common yang kita tengok apa? Patient akan tercekik apa, tulang ikan kan? Fish.
Tulang ikan tu.
That's very common lah, fish bone. Most of the time you do X-ray, you won't be able to see, because very small. Unless if the fish bone itu memang besar lah. Most of the time yang dia tertelan is all the small bones kan? Okay. So the small bones, sometimes you do X-ray, most of the time you won't be able to see. You can do direct visualization. Kalau tak nampak, then after we just refer to ENT. They will usually see the patient next day lah. Okay. So because if let's say because the bone let's say kalau you tertelan the fish bone, then it stuck somewhere in your throat, most of the time dia akan dissolve on its own. After few days dia akan memang tak ada lah. So this you can just give reassurance lah. Yang emergency, let's say kalau fish bone tu besar or patient tu is immunocompromised lah, risk of infection, that one maybe you need to remove early lah. ENT need to see early. But otherwise they can see the next day je for this kind of cases.
Okay. So, alright.
So what about battery?
Oh, battery.
Battery. Why battery need to be removed urgently?
Sebab
Wishbone Dr. Rafeek kata you can use silicone tomorrow. Kalau ada battery, they have to remove it immediately, even though there's no airway compromise. Jangan lah, esophagus ke, dalam trachea ke.
Dalam esophagus takut masuk dalam stomach ke doktor?
Yelah, tak apa. Kalau masuk dalam esophagus, LT kata surgical punya problem. Tapi what I'm trying to get at is, even if it's masuk esophagus ke, masuk dalam trachea ke, you need to remove it urgently. Why? Kawan-kawan boleh tolong jawab. Tak perlu bersembunyi di belakang huruf-huruf. Ada seorang kawan depan saya ni.
Oh my god.
Apa dia? Pasang speaker, dia orang lain boleh dengar.
Maybe takut content from the battery leak and erode the airway.
Excellent. So basically, the problem with battery, it contains a lot of chemicals. And problem sebab tu bateri casing dia tu besi kan. So bila awak telan bateri, your IMU, your stomach juices and whatever ni is conductive. So you're gonna cause shock. You know, the positive and negative terminal of the battery akan bersambung lah. So it's gonna cause shock. And because of the shock tu, dia akan menyebabkan the corrosive material dalam bateri tu leak out and cause irritation, erosion to your lining of your trachea or your esophagus, and left it long enough, it can cause perforation, which can be more dangerous lah. Perforation dekat stomach apa semua okay lagi, but what if perforation dekat esophagus, dekat mediastinum, then you get, you know, food contact masuk mediastinum. It's gonna be horrible lah nak bersihkan mediastinum apa semua. So that's why kalau swallow button battery, it's an emergency. Need to remove it immediately or as soon as possible. Tak boleh tunggu next day. Bukan apa, sebab kadang-kadang you refer your ENT clinic ke apa semua, oh tak apa lah, get appointment kat klinik tomorrow. Then by the time tomorrow dah perforation apa semua bersalah lah. Just be aware. Certain things memang tak boleh tunggu esok. Button battery dalam stomach ke, dalam esophagus ke, dalam bowel ke, that needs to be removed immediately. Okay?
Okay.
Carry on, Kira.
Okay, thank you. Okay. So next is regarding the Peritonsilla Abscess lah. It is a localized accumulation of pus in the peritonsilla tissue that forms as a result of suppurative tonsillitis. Most common bacteria will be beta hemolytic streptococci lah. And also patient will come with symptoms of sore throat for several days, high grade fever, pain localized to one side of the throat, odynophagia, dysphagia, and also associated with halitosis, and a hot potato sounding voice occur. And then patient also boleh ada trismus lah, which is a spasm of the jaw muscle, limitation of ability to open the mouth. And during inspection, we can see tense and bulging tonsil pushing the uvula away from the affected side. Tak usah ada gambar ke tak. And then for treatment, we can give the IV benzopenicillin 1.2 gram ataupun clarithromycin lah kalau patient allergic to penicillin, and then refer ENT for aspiration or formal drainage. Gambar
Halitosis ni apa?
Sorry, Doktor?
What is halitosis?
Halitosis tu,
ada orang tak tahu dan malu nak bertanya.
oh, it's a bad breath lah.
Yeah.
Bau.
So patient mulut bau busuk atau kawan-kawan yang mulut bau busuk, assuming that dia gosok gigi hari-hari lah. Tapi mulut dia si bau busuk, you need to suspect lah. Takut ada some abscess ke. You know, sometimes patient datang tak berapa conscious kan, elderly, datang lethargic. Tapi then you notice suddenly for some reason the breath is exceptionally bad kan. Have a look inside lah. Mana dah tahu kan.
Okay, for antibiotics, normally kita bagi augmentin lah. First. Augmentin, okay.
Okay, tu.
Penicillin usually kita tak bagi kat sini lah.
Oh. Okay. Dia lah ni, and then ni just gambar je lah untuk tengok dia memang nampak deviated uvula and then swollen tonsil lah. Okay. Okay, itu saja saya punya presentation, ni reference saya. Habis.
Okay lah, okay lah.
Habis dah Doktor.
Ada soalan nak? Soalan kawan-kawan nak tanya soalan? Kawan-kawan dah ramai sikit lah. Okay, tambahan lah. Besides your auricular hematoma, another thing yang maybe terlupa nak mention is you can also have septal hematoma. Nose. Kalau you ada septal hematoma pun is an emergency lah. Okay, sebab kalau you don't drain it, then dia akan kat your septum tu akan deform. Macam your ear boleh deform, your septum pun boleh deform. Nanti deform can also have a perforation in your septum. Nanti septum tak ada lah. So that one also is an emergency lah. Okay, is septal hematoma and also your auricular hematoma lah. Need to be drained lah, drain ke early lah. Intermittently.
Okay, itu saja. Terima kasih Doktor.
Okay lah, okay, thank you. Okay,